Thank you, and good afternoon. As a region, we have made great progress. When you look back on where we were at the beginning of this and you look at where we are today, we continue to see our region being a model for our response to this pandemic outbreak. But we want to make sure that that tremendous progress does not lull us into a false sense of complacency or a false sense of security. The reality is that without a therapeutic treatment and without a vaccine, we have to continue to adapt what we do every single day as we continue to move forward and coming out of the mindset we've been in, and we continue to ease some of the restrictions as we move forward. And in that mindset of adaptation, we want to talk for a minute about how it is we move out of this. We move out of this in the hopes of not triggering mass outbreaks and spreads by continuing the four corners of what we've talked about: physical distancing with non-household units, temperature checks by employers screening their employees when they come in to try and early identify those with symptoms and get them tested and get them in a state of isolation. The continued and rigorous use of hand washing, which we know is a very effective tool to stop the spread from your hands into your eyes, your nose, or your mouth, and then the utilization of face coverings. No one of these four things is foolproof, but it is about mitigating risk. And each of these four things mitigates the risk. And when all four are used together, it does provide significant protections. I know that the face coverings are uncomfortable, at times can be irritating, but rest assured, a face covering is a lot more comfortable than a ventilator. And so we continue to urge you to follow these types of things because it puts us on the path to continue to reopen. And we want to continue on the path that we've been on. We want to continue on the trajectory of moving forward and continuing to provide more openings. It is in this same spirit that we continue to remind San Diegans that mass gatherings are inconsistent with the public health order. We also want to remind you that mass gatherings are a place that triggers the majority of the outbreaks. We often hear that in today's environment and what we're dealing with, the largest number and most significant number of outbreaks are at congregate care settings. That is because that's the only place that's congregating. That's the only place where a significant number of folks are living in close proximity to one another. And so as you look around the country, you see other outbreaks happening at religious ceremonies and events where people are choosing to gather in time and duration and intensity in a way that helps facilitate the spread. And so we know that there is a desire to get back and move forward, and we're certainly moving forward, but it is really incumbent that we do this in a responsible way, that we do this in a phased way, and that we continue to move forward together. And so we want to continue the progress we've made and not be lulled into a sense of complacency and continue our path to reopening. Supervisor Cox mentioned the economic stimulus and humanitarian efforts we did with Federal CARES Act funding yesterday. He talked about the money that was made available for cities. In addition to that, we allocated $17 million for economic stimulus programs, in particular for our small businesses, and being mindful of the impact on all of them, but especially our hospitality industry that is probably going to have the longest tail in terms of recovery. We think that's an important part of what we're doing. Our board also allocated $15 million for behavioral health services, mental health, and drug treatment. We know that the number of tele-connections or remote connections has obviously gone up significantly with the coronavirus pandemic. But we need to provide help and support to our providers in technology and training. We want to help facilitate the teleconnection around mental health treatment and drug treatment in a sustained way to make sure that we can meet the need of individuals who are suffering and having difficulties out there. And we appreciate our board's support of that. We also provided $2 million in support for child welfare services. There's been a significant decline in the number of calls to our child abuse hotline. And that is primarily because the single largest entity that calls that line is teachers, who are mandatory reporters, and they observe kids who are in difficulty. When schools are not in session, teachers are not able to observe and they're not able to report, and we think that these $2 million will help us get more staff out, checking on kids, engaging with families, and doing everything we can to ensure that our children, particularly those who are in vulnerable situations, are cared for. And we think this is an appropriate use of the Federal CARES Act money and something that is vitally important. I wanted to provide some additional information on funerals. According to state guidelines, funerals are now permissible and allowed so that loved ones who have lost someone can be in a position to say goodbye and to have a proper burial. Funerals in San Diego County can be performed either inside or outside. We encourage outdoor ceremonies, outdoor remembrances, outdoor funerals, because it is less danger, but we are allowing either to take place. All those who attend must wear a face covering, and there must be 6 feet of physical distancing between household units. We also encourage you to limit attendance at these. Obviously, folks want to grieve, and we believe that that is appropriate and what should happen, but we would encourage you to limit attendance. And we want to give our strongest possible encouragement that older people or those with underlying health conditions, although they are allowed to attend funerals, it should be extremely limited. And if those who are elderly or have underlying health conditions do attend, we urge you to exercise extreme caution because you are at much higher risk of developing serious COVID-19 illnesses. To be clear, a house of worship that performs a funeral is a one-time event directly associated with the funeral, and there are no ongoing religious services allowable at this point outside of funerals. We also want to provide a little clarification around restaurants. While, as Supervisor Cox mentioned, we are still waiting for the state of California to give us the green light on our regional variance plan that we submitted to them. And so because we are still waiting on that, to be clear, in-person dining in restaurants is not presently allowable. The state of California has said counties that meet the metrics will be given the approval. We believe we met these metrics. Our board voted. We received that information. We voted unanimously that we attest to meeting those criteria for both in-person dining and in-store retail. Those plans have been submitted to the state of California. They will review them. If they approve them at that point and that point only, will we be allowed in our county to have in-person restaurant dining. For our restaurants that are planning to open in-person dining, we've tried to make the compliance as simple as possible. If you go to our website, coronavirus-sd.com, there is a safe reopening plan designated specifically for restaurants that you can see. You download the form, you fill it out. You submit it to the County of San Diego, not for approval. We do not approve it, but you submit a copy so we have one on file. You post it publicly outside your restaurant. You share it with your employees, and then you are free to go once we get the okay from the state. The state of California has put out their own guidance around restaurants. We think you should use that as a guide. It should inform your thinking. But the only thing that you will be required to do once we get the go-ahead from the state is complete our safe reopening plan for restaurants, which is available on the county's website. Again, complete it, email a copy to the County of San Diego. That email is on the form. Post it outside your restaurant and share it with your staff. On beaches, we know San Diegans have been doing great adhering to the guidelines. We know that we love our beaches. We know we're heading into a holiday weekend. And we want to let you know that we are working with the coastal cities, with the mayors and city managers and lifeguards who represent all of the jurisdictions who have beaches in San Diego County. And we are working with them on their ideas and suggestions around easing some of the restrictions on the beaches, potentially allowing things like sitting or staying or other types of things. We expect to hear back from them next week. And once we hear back from them and we take it under the advisement of our public health officer, then we hope to be in a position to ease some of those restrictions on beaches. But as we head into this Memorial Day weekend, we want everyone to remember the current restrictions in place will remain in place throughout the weekend. There is a requirement that you wear a face covering when within 6 feet of someone else. There's a requirement that non-household units remain 6 feet apart from one another. Also important to note that on the beach you can walk or run. You cannot be stationary or sit down. If your local beach allows dogs on the beach, then consistent with that local beach's rules, you can certainly take your dog. And then you can get in the water to swim, surf, paddleboard, kayak, snorkel, recreational boating in our ocean, bays, and lakes. But again, only with members of your own household. And beach parking lots remain closed and will remain closed at least through the weekend. All cities have the ultimate say as to whether their beaches are open, and so please be sure to check with your local jurisdictions. Quick update on testing at the Convention Center for Homeless. We are presently at 1,562 have tested negative. 4 have tested positive. All 4 of those were residents of the Convention Center and not staff. 3 tests are still pending results, and 27 are indeterminate, and we are awaiting retesting of those individuals. Before we jump into our charts, I just want to point out today is another milestone for us. This is our new single highest day testing totals. And I want to take a moment and commend our T3 staff and team led by Nick Mascione, the Director of Health and Human Services, along with everyone in our public health lab who are working tirelessly to break through the barriers to set up process and protocols, to get pop-up testing in place, to have our strike teams going out to skilled nursing facilities and other locations, to make sure that we are not only increasing our testing, but we are doing it in a thoughtful way that helps inform the actions we're taking surrounding coronavirus. And we obviously have a ways to go, and we want to continue to make progress, but we continue to see our testing numbers increase, and that does not happen on its own. That is a testament to a lot of folks who are working very hard, and we appreciate their work. So we'll jump into our T3 chart here. You'll see today we're reporting 4,802 tests, our new single-day highest number of totals. You'll also see in the chart there we're adding a 7-day rolling average. We're going to have day-to-day fluctuations. You can see our 7-day average there at just under 4,000 per day. We obviously want to get to our goal of 5,200. We would like that to be our 7-day average and not just a one-time occurrence, but we continue to see positive progress as it relates to testing. Total tests reported to date is 115,837. Just as our testing continues to increase, our tracing capacity continues to increase. We're now at 281 contact tracers and case investigators who are out every single day working with those who have tested positive, identifying their close contacts, reaching out to those folks and doing everything we can to daily tackle and wrestle and control the spread of coronavirus. Total investigations performed now just shy of 7,500. Treatment 139 individuals in our public health rooms with over 700 cumulative. Out of today's total testing, we'll share with you the total positives. Again, this is encouraging. 4,802 tests performed today. 114 of those were positive. That is a 2% positive rate. That is below our 14-day rolling average of 3.6. As we continue to increase testing, we expect this number to continue to trend in a downward trajectory. Next, on hospitalizations, you will see a slight uptick in ICU utilization for COVID. Again, just about where we were 5 days ago in terms of 155. 387 total COVID-related hospitalizations, and you can see across here staying relatively stable as we move forward. Out of the 387 hospitalizations, you can now see where that is in relation to our total hospital system capacity. COVID plus non-COVID patients puts you at 3736, which gives us a healthy delta between the total bed capacity. These are the things that allow us, along with others, but these are the metrics along with others that allow us to feel comfortable in continuing to move forward with the responsible and phased reopening. Final chart is our cumulative stats here. You can see the cumulative positives, cumulated estimated recoveries, cumulative hospitalizations and ICUs. Most of value on this chart is the doubling rate of hospitalizations, ICUs, and then, of course, the unfortunate loss of life. That concludes my section of the report. I'll now turn it over to Dr. Wilma Wooten for her Public Health Officer's briefing.